Oh, all right. So hello and welcome, everyone. Glad to introduce to all of you Philip, who's currently pursuing his DBA in healthcare management at the Rushford Business School. Phil has over 15 years of work experience, and currently at his work front, he is successfully wearing two hats. He's the lead responsible for data analytics projects and managing the CRM at MCH, where in just 2 years, he has established a group-wide CRM and its related state-of-the-art infrastructure. Creating data management processes, undertaking data strategy, creating a central data analytics platform for big data, BI, and analytics are some of his key functions. He's also responsible for recruiting and training his team. Besides all of this, he also teaches data management to data science students and digital business management at the Baden-Württemberg Cooperative State University. Phil is a trained cameraman, and he's made a film, a love story on Super 16mm. He has for nearly 10 years worked in the front-end development area, of which for about 5 years he was associated with Siemens. He also specializes in CX UX designing. Now, I've had numerous conversations with Phil, and one thing that really stands out in each and every conversation that I've had with him is his passion towards improving patient treatment and care. He has extensive experience in the field of data science and management and customer experience. And he wants to extend the combination of all of this to the healthcare sector to manage patient data in a manner that their time and resources are not wasted and their overall experience in the healthcare journey is enhanced. So with the same motivation, Phil is here to give us a curtain raiser on data management and its application and possibilities in the healthcare sector. I'm extremely thankful to you, Phil, that you consented to share your knowledge with us. The stage is all yours now.
No, you're welcome and thanks a lot. Do you hear me? Do you see something?
Yes, we do.
We tried it 1,000 times before and hopefully it works now. So yes, great. And thanks for participating in this webinar. It's about data management in healthcare. As Sofrita already said, I'm working in the area of data management, building up a team and working with data. And I'm developing in healthcare because I think the combination of data and also the need of kind of data management in healthcare, it's really emerging with upcoming of more and more data. Some welcome facts. I think it's really important based on Sufrita's feedback. Thanks for that. This will be around 30 or 40 minutes. Depends on how fast I'm speaking. I have prepared 46 slides. Hopefully it's not the mission impossible. I try to go through it and everything I will say here is gender neutral. It's important. If I say him or her, it always means the same. Yeah, I think it's important to say that. Topics will be around what is data. This sounds like a funny question, and it is, but you got very, very different answers if you ask that. From the definition of data, I will go to data management, kind of an overview about what means data management, what processes and frameworks are there. I will hand over to the patient data management with a kind of dig deeper into the patient part. Go over to the data in digital health. It's a kind of broadening the field, more in digital health and what data plays, what role data plays in digital health. And I also have prepared some examples, some concrete examples I will show here, go through, and yeah, then in a summary and outlook, and afterwards, hopefully we have some time for questions if there are some. So what is data? The definition, as you see and hear, everyone, or many people are talking about data is the new oil or the new gold or whatever. On the one side, this is true. You can say it is like that, but it is not by default. In many companies, there are many different systems, as you see on the right, many different systems with scattered data bases across the data you have in the different systems is not usable by default. So if you want to access the data from an app or from a CRM, you can't do that by default. You have to combine it, or make it accessible like that. So the reasons for this kind of difference between stored data and usable data is sometimes the lack of APIs or other exchange possibilities, no access to the data. And if there is access to the data, then it's not modeled or loaded like that. It's kind of combined to bring value out of it. So the importance of data, like you see different layers here on the bottom. It's data, then come information, knowledge, and wisdom. And I think if you're talking about data, then oftentimes you're not really talking about data, but about perhaps wisdom or something else. To make sure, that you can reach wisdom with your data, you have to enhance your data quality. You have to make sure that your data is in a quality that you can work with, that you collect the right data, that you store it in a right way, and you make it accessible in the right way. If you then have the right data quality, you can gain information quality, you gain information out of the data, make value out of it. And after that, after this information that's available, then you have the possibility to kind of do the right decisions and also enable the business to kind of decide for the right business outcomes. It's building on each other. On the right side, you see you have to bring data in a context. It's not a standalone data. If you have, for example, a customer that is visiting a website, that's interesting data. It's an information, but if you bring it together and you see some this customer is coming back again and again, and he's looking on a distinct product, then you get the knowledge, perhaps also actionable information. Create that out of this information, enrich that, and with this knowledge, you can kind of perhaps contact this customer with a newsletter or an email, or directly invite him for an exhibition or something in my case, or kind of reach him directly. You can apply your knowledge. You get wisdom out of that. So learning from that is its data is not standing alone. Its data is something that's a basis for wisdom in this case. The good thing about data, and also the ugly thing about data, is it always has context. So it never stands alone. Yeah. If you think about this question, is 6 a big number? Then if you think about that, you have I think different answers on that. If it's I think it's not a big number per se, but if you look on a dice, then it's truly the biggest number you have on the dice. So in the context of a dice, 6 is a big number. Perhaps on another way, it's not that big. So data in a context. There are different manifestations of data. In this case, I like it because it looks that technical. Yeah, I'm not the technical guy, so to name that, but sometimes data is in a way technical. So with different manifestations of data, in this case, it's base 64. And you can have another manifestation of the same data in binary format. But in the end, the funny thing is, perhaps it's a cat that looks funny. Yeah. And this is another manifestation or representation of data. This is then the image format that's consumed by people, from humans like us. There are different types of data. Again, the technical part, hopefully you don't quit the session now, but it's getting less technical in the future. But what I want to say here is there are different types and definitions of data. If it's the technical way, a timestamp or string or array, or if it's some types of data like images or text or numbers, this is always, you're talking about data meaning something different. Again, another definition of what types of data are there. There is cultural data, scientific data, natural data, geographical data, and so on. And again, another definition of types of data is qualitative data, quantitative data, and so on. Yeah, you see the point. If you're talking about data, it's not that obvious what you're talking about, really. When you handle and when you're working with data, it's important that you always have in mind the data quality. And for data quality, you have to define what does that mean, data quality. And there are, it's a definition, it's a standard of kind of six dimensions, data quality dimensions. I think it's important in every case when you're working with data, you have the data accuracy, the degree of which the data correctly represents the entity or attribute being described. You have the completeness. Have you missing data from any data set? Is it consistent? Is it every time the same age for a person, for example, or does it differ? Is it valid? Could it be possible, for example, that someone logged in the future date, or that he is 260 years old? The integrity is also a very important data quality point, as well as the uniqueness. Kind of, if you have duplicates in your data set in the CRM context, you could have some problems. Best practices in data quality management. What's important here? It's important that you make data quality a strategic priority. That's something you have to make intentionally. You have to plan it, enable people to do that. If you make the data entry, like in forms or something like that, available, automating data entry, then it's an asset. Because if you prevent duplicates, it's just more effective than curing them. Kind of, if you have duplicates in the system, it is an effort to remove them. Better is to make sure that there aren't put in duplicates from start. There are different data sources and methods to collect data. It's on a classical field around CRM. There are newsletter tools where you collect data about customers, marketing automation tools, CRM, and all the tools, perhaps like ERP, web tracking, IoT devices, and many more. In healthcare, there are some special, let's say, data sources or collections, like studies or experiments, surveys, observations, also hospital information systems and wearables more in usage. The value of data is something I researched a lot, and you don't get that much feedback on the question how much dollars is a customer data set worth. If you research, you get some answers. There are some studies about that, but I think what is consensus is that there are different approaches to value data. It's the cost-based approach. The first one. This means what would it cost to recreate this data set about a customer or someone else, and then you see perhaps it costs $10,000 or more. Then you get the market-based approach, like estimating if it's sold on the market, what would you get from that? Or is it the value-based approach? What amount of value and what kind of value, or quantifiable value, does the data give to the company or processes? This is kind of a short overview about data. Now we're going to data management. How do we get to better data quality? And kind of starting with a definition about what data management is. Data management refers to the process of organizing, storing, and maintaining data. And that it's important, the it's done for a reason, and to make data accessible, secure, and accurate. Why data management? Data management is important to improve efficiency and quality and insights. Also make sure that the data is stored securely, and it's compliant, like GDPR, HIPAA, and Swiss data protection. Different regulations when you handle especially personal data. And it's also collaboration, make it easy to share data for teamwork and productivity. Data management activities, there are processes like the CRISP, DM process that make clear how to structure the data management. It involves a wide range of activities and techniques, such as data collecting. It's important to collect the right data at the right source, make it available, process it, like as a second part, process it, clean it, make it ready for data analytics, and also visualize it. And on the right side, you see that it starts with the business understanding. You only can manage data if you know what business you are in, if you understand the business processes. Alongside these are then the data collected. Then you can understand the data, prepare the data, model the data, evaluate if you got the right data and do the right thing with the data, and then you can deploy it. Data lives in a life cycle. If you think about that and you work with data, then you see sometimes we expect data is kind of static. If it's there, yeah, that's good. But data has kind of a lifespan as well. It starts with the acquisition of data. Where is it collected? After collecting the data, stick to the example of tracking data from a website. Then it's stored in a DMP data management platform or wherever. Then it's processed to bring it together or enrich a CRM profile with it. It's used to, for example, if you have this CRM profile, to send personalized newsletters based on that. And then after distinct years, you have to also make sure that the data is deleted or anonymized based off different regulations. I think that's you could also show that as a circle, but I think it's really kind of clear. I think also say that there are different types of data that yeah. The funny thing about healthcare data is it's not like other data. If you know something about a person, what a person, for example, has clicked in a web store 10 years ago, it's not that important after 10 years. But healthcare data is getting more and more complete in the kind of lifetime, and that makes it more and more valuable over time. If you want to have a step-by-step guide how to manage data, I go over that a little bit quicker, but you can have a look on this process. This is named data product design thinking. It's a combination of design thinking with data product management. You have to define the objectives, what product, data product you want to create, what data you need for that. You have to develop a strategy and integrate it in the company strategy, collect and store the right data, process and clean it, analyze and visualize it, share and collaborate it, and secure, make sure that it's secure and protected, monitor and maintain. That's the most important. It's not the most important part, but also often missed. Monitor and maintaining the data pipelines. It's really very important. So there are different views on data and also data management. On the one side, we've got something like the CRM system or something like that. It's operational data, the data systems, operational data exchange. But on the other side, also the analytical data, working with a data warehouse or something in the background that's aggregating the data from different sources and then makes it ready for BI, business intelligence, analytics, or also machine learning or AI. It's a different view on data and data management. Now we come to patient data management with the history of patient data. And also, yeah, kind of, I'm working for an exhibition company at the moment, and we also, in this environment, we sell tickets. And till some years ago, we sold tickets, really paper tickets, and it's now digitalized in ticket shop. But in the healthcare, it was not that long time ago that patient data was kind of collected with paper in a paper format with a kind of writing nobody can read afterwards, like that. So this is due to sometimes no time to fill in. It's an urgent patient, and later on there's no time to fill in this patient data correctly. There's no storage to store this data centrally, and hey, I don't know how to use it in the future, so it's not that important for me to fill it in correctly. So the effect of this is oftentimes information is missing during a patient visit, like lab results, other history, physical exams, and so on. And yeah, the actual developments go into it's a solution, electronic solution for electronic health records, where different patient data is collected in one data set with the potential to lower costs, improve productivity, and increase patient comfort. So it's kind of making processes efficient. If you've got like I mentioned before, if you've got the standard defined process to collect the data, then you can collect the right data. You can make sure that it's collected in the right way, that everything is in place, at least what you need, and also you can have many kind of impact on the patient journey and comfort. Yeah, but yeah, the basis for this is interoperability and data privacy, and I come to that later. For me, it's important not to only to see the electronic health record as one kind of closed ecosystem, but to see the patient journey, to understand also where the data comes from and in which state of the patient journey. As it starts with a diagnosis, so it has a treatment phase, perhaps it's a life change in between, like a pregnancy or an acute illness. It's a surgery and so on. There are more diagnoses going on the patient journey, and to understand the data, you also have to understand the patient journey and vice versa. With the right data out of electronic health records and more, you can also enhance the patient journey, like predicting the right treatment and things like that. Yeah, we had the electronic health record kind of widening the view. You have real world data coming from different sources, not only, for example, like the electronic health record from a hospital system or something like that. It's this real world data is coming, for example, from different wearables patients or people have, from survey data, claims data, hospital data, but also, and that's really interesting, from social media data, perhaps also from web search, where someone is looking or searching for a distinct topic or registering for a newsletter or something, a distinct topic or illness. And then you could collect this data to get a good overview about the status of a person. So this is the same kind of shown differently. Also important data you can use as literature, perhaps also family history. That's also something very important for different use cases. And this is the patient reported part. This would be some part of what I'm more digging into with my dissertation. It's like how do patients report their kind of perception of the treatment and everything like that, like diaries or everything else like that. But you also can use weather data, traffic data, and so on. This is then the real world data. Data in digital healthcare, where data plays an important role. There are many challenges, but also opportunities on the way to use data in digital health. like I said, the data diversity coming from different structures, formats, kind of missing standards, existing systems that don't use data exchange standards, not integrated, with different data quality, still handwritten papers for patient data, and it's not consistent. Everyone kind of fills in a name like a different way. You've got to be data compliant, data privacy compliant. You have to make sure that data, really patient data, have to be stored really secure. And you have also to think about in the future when there are quantum computers, for example, how really to store data securely in the future. Also, encryptions then are not that secure anymore. Data interoperability is also very important to kind of break down the silos from different data sources and make value out of the data. And then if you have the data available and integrated, also analyze and visualize data and bring it into usage. I will shortly go over the big data topic. Big data, yeah, I think it's not only big data. It's important to have this understanding. There are different approaches on data. On the one side, it's batch processing, where you take a batch of data and handle it over. On the other side, another way to handle data is stream processing. It's for real-time data processing, where the data is collected or from variables, for example, it's integrated and used in real time. Yeah, and for each of this, you need different infrastructure in the background to handle the data. There are different ways of formatting data. It's unstructured, unorganized data like videos. It's like named like that. It's semi-structured data like in a JSON format, but JSON formats can be formatted a different way. It's structured, but it's can be structured differently. And the structured data, the classic databases. As a short overview, it's really colorful. Yeah, the 10 V's of big data. The most important are volume, velocity, and variety, which are defining the different kind of attributes of big data. It's not only the size, it's also the speed at which data is generated and should be used. Do we need real-time data or not? And also the different types of data accuracy you need, and so on. Yeah. See that the 10 V's here that make then big data. One interesting thing I came across when I did some research for this webinar was the Internet of Medical Things. I knew the Internet of Things, but seems like this is a new, I don't know, perhaps you can say it's a buzzword, but it's a specialization of Internet of Things. It's the Internet of Medical Things, where medical devices, wearables like Apple Watches, are used to collect the right data, and applications also that connect healthcare IT systems through networks. Yeah. More with a focus on medical devices and also integration in machine to machine, and it's nothing new, but it's on the medical sector adopted. The challenge for all of this is interoperability. I think I said it sometimes now. For this, it's important to have a kind of definition. This is an official definition of interoperability: the ability of a system to exchange electronic health information with and use electronic health information from other systems without special effort on the part of the user. So it's also always important to have an official definition, as it is the basis for many of the developments in the future. So holistic approach and architecture in the background, it uses APIs for easy standardization and data exchange. It's important for data processing, for big data processing. You have a central data storage, and then you can develop an it's not a word I can't say, but you can see it. AI and machine learning are built on that. There are existing data exchange standards in healthcare, like fast health interoperability resources, APIs, and SMART. They are used in new systems, but there are many legacy systems around there that don't use that yet, but I think in the future there will be used more and more. An important part for me is to get into the patient centricity. This is value-based healthcare. It's an approach, a development in healthcare that puts the patient into the center of everything in healthcare, kind of respecting everything, having all the features or facets of a person, from chronic conditions to perhaps clinical trials. He's taking part or she's taking part, coaching, peer group, social media forums, fitness, and the kind of wearables he's using, and all of that. And this all impacts the patient journey and vice versa. Should be collected to find the right treatment. Yeah. Coming to the examples, like the patient journey analytics, I found some cases that are interesting cases for data in the healthcare sector, like the patient journey analytics, also personalized healthcare with wearable data, and the Internet of Thing-based health monitoring. You see analytics with real-world data has different assets. You can use it for controlling the trials. You can improve the evidence of economic value and improve it's a word. But you can use it, the analytics and the real world data in different streams and different sectors. It looks like this if you integrate different sources on the left side. We have trial data and real world data, also commercial data, and to kind of collect the right data and most of the data from a patient journey to do analytics, you need a data analytics pipeline with different platforms in the middle, like store, collect model data. Then you can analyze different models, create these models, analyze the data, and then you get insights for the users, payers, also for the patients. Then in the end, but it is an infrastructure you have to set up, and it is kind of a technical process to make that possible. So coming to personal care, digital therapeutics, it's BioVitals HF leverages AI and data analytics to detect early signs of heart failure. And they do that by comparing physiological signals from wearable sensors with data from other chronic patients. So they use big data and reference data and compare it with AI. The AI compares it with the actual wearable sensors, and then they can predict heart failure. I think that's something that's really valuable. The usage of data and big data for a distinct case that could be really life-saving. This also allows doctors to make more accurate predictions and medical recommendations, as it uses the data available from other patients to predict or propose the right treatments. It goes also in kind of more personalized and stratified healthcare, not the one-size-fits-all treatment, but it's based on the kind of environment and status one has. Then next example is wearable Internet of Things. And this is real-time health monitoring with the different steps, with a sensing layer that collects the data from different sources, like wearables, like also perhaps sensors in the house, wristbands, smartphones, and so on. Then you've got the networking layer where data is transferred securely and fast. With the data processing layer to get process the data, get data-driven insights, and the application layer to serve the data in different apps and use cases, like then mentioned in the example before, the app. Then you can use the data for that here. So this is then the end of my webinar. I've got a short summary for you, and then afterwards kind of an outlook out of my view, and then hopefully we can have a short discussion. The definition of data is not a no-brainer. There we have different answers on what is data. Data management does not occur, but must be planned, aligned, and implemented intentionally. And with great data comes great responsibility. So if you've got the intention and you have got the data to use, then you have also to put the patient's and the person's rights in the central and to be consistent with the guidelines and regulations. Along the patient journey, there is much optimization potential with big data and analytics that's not leveraged yet. So as an outlook, there will be massive development in digital health solutions in the next years. The workflows and processes will be more integrated, digitalized, and efficient, hopefully. And the education and health must focus more on e-health. And the data management will play an even bigger role in the future as a foundation of digitalization. Thanks a lot.
Thank you, Phil. Daniela is here. I do have one question, if I may. Based on your discussion about digital health and e-health and being implemented more and more every day, how is it planned to cover the GDPR and data protection with these systems?
Yes, I think it depends on you have different processes, and data protection or the GDPR is a guideline how to do that. The most important part, I think, in handling personal data is ask for the consent, like and store the consent, that you make clear for what data is used, or especially the personal data, how it will be stored, and also when it will be deleted, and how you can, that you also can kind of have access and manage your data, your personal data, that you can kind of create or let the data be deleted. There must be processes.
So basically every patient who agrees to undergo the digital healthcare needs to provide a consent for every system, correct?
Not for every system per se, but for every use case. In the marketing, it's like you have to have a consent for someone to receive a newsletter, but you also have to have a consent for someone that he want to be tracked on an exhibition, for example, or that you can create a profile out of his personal data. This is more from the use case perspective, not from the system perspective per se.
But my question is, how will this be covered specifically in the digital healthcare?
Yeah, I think
how will you obtain the consent from the patients?
Yeah, I think this could be done in a process. If someone is visiting a hospital for the first time, then he is asked when he kind of before the treatment, then he's asked if and for what could this data be handled? Like, can we store it in our electronic health records? Can we send you automatic reminders, for example, for further treatments or something like that? This must be in the patient journey embedded. And one place would be the first kind of point of contact with a hospital or a doctor.
Okay, thank you.
Thanks,
Phil.
Phil, if it is possible.
Sorry, what?
Thank you very much for the presentation. And I have also a question regarding the capturing of the accurate data. Recently, I read an article which stated that the AHR data, which is captured, the patient data, I mean, is not always so much accurate. So it's about 20-30% of accuracy, and still, like, hospital needs qualified staff to again check this data and to give the diagnosis in the right way. How do you assess the impact of AI today in this decision diagnosis making process? Do you think that in 10 years, maybe, it will be possible to fully substitute people working in this area? Thank you.
Do you mean substitute the healthcare personnel, or do you mean the healthcare personnel dedicated to data quality, data capture?
No, mostly I mean doctors rather than
okay.
person.
Yes, in my experience, it's always at the moment it's an asset. You can use AI and all the predictions. They propose things, but oftentimes it's a combination of both. Most of the systems that use predictions, medication, treatment predictions, and things like that, or proposals, they are then these proposals are then used by doctors for the treatment. And I think, yeah, it's also an ethical question. Do you want to automate a treatment completely, and then who's responsible for this treatment if it's maltreatment, for example? It's like e-cars and automatic driving cars. I think it could be possible to get in the future, right, like really a good rate of correct predictions and proposal of treatments and things. But it's also, I think, one of the most important part is who's responsible then if it's not a good prediction. And this must be then also be clarified till then.
Thank you so much.
Right. Do we have any more questions? Philipp, in your opinion, what looks like, the future of healthcare digitization? Where do you see it go? I mean, I do understand, there's ethics involved, and there's this, I mean, with all the data that you're getting from the various sources. So where do you see, digitization taking healthcare? I mean, how far would that happen?
Yes, I think it's in progress. It's coming more and more into focus on different levels and different organizations. But it's a way. It's a long way, and you've got to combine IT and kind of business process, more IT part with a healthcare part to combine processes and technologies. And you've got to do that careful and intentionally, but I think it's on the right way. There are many vendors I've seen on my research that are serving APIs and middleware platforms that have this kind of connectivity, make it available to connect systems in an easy way. Like this is their marketing, but the reality is sometimes different. But it's like the developments like in the right direction. I think and I hope that in the near future we have a more interconnected digital health system, at least at a country level, when that we can use in a good way and a secure way the personal data, make use out of it. But Germany is not the one country that's kind of most upfront on that development at the moment, unfortunately. So here it's a little bit more potential. And I think AI and data, it's playing a big role in the future, but it's not standalone per se. I think you've got to think many things, like the automatic driving cars. You've got to define, what's how to decide and who's responsible for that. I don't know if you saw this. There was a kind of a setup where people could kind of propose different situations for a car, the driving against the wall or against people crossing a street, and they had to decide what they would do, and this was the basis of the decision model for an AI driving a car, and all of that has to be defined for healthcare as well. If you've got a triage, who's treated, who's not, then it's not that easy. Could be done per AI, but then yeah, AIs are sometimes black boxes.
Yeah. So we're basically looking at data strengthening the kind of outcomes that medical personnel will be able to give, like the doctors and the nurses and emergency treatment, etc. So if there's data, about a person who's, let's say, met an accident, and in that emergency, if a central network can provide all possible data about that specific person, then probably providing healthcare in that situation would be more beneficial or better, or maybe the person can receive better treatment.
Yes, right.
Rather than digging history and trying to find out information about that person.
Mm-hmm. Also for chronic diseases like that, you get a reminder for catching your medics, or appointments for older people like that. They get a reminder on a regular way, that also kind of doctors can plan their slots more,
Right.
securely, and it's also money relevant.
So Phil, my question is, so you mean that the data is shareable between hospitals?
It could be, yeah.
It could be, or it is.
It's not at the moment, but it depends
Okay.
on whom you are asking. In Germany, it is not, definitely. So, but yeah, you have to ask why it is not, and what are the impacts if it's available. If you in the future, if you would have one central database for electronic health records that's valid worldwide, you could think about something like that. And if you're on vacations in another country and you went ill and you go to the doctor, then perhaps it would also be an asset that he has his your data and knows what medics you're using and everything like that. But this is something, it's sensitive data. You can tell that. And
so it's a
GDPR
few
now
of the digital governance.
It's digital governance, but also digital potential. Yeah, you can't use data you don't have available. And it's also concerning the question, I think two times before, it's like integrating the data and collecting the right data and automating the data collection to enrich the profile of a patient. In this case, it's an asset for the future. It's not collected like in a way, in a standardized way at the moment. So you can't rely on, if someone is writing a German name, Manfred Müller, you can write it in 1,000 different ways. No, not 1,000, but 12 different ways and typos and in between. Then for a data system or for a digital system, these are different persons. So if you've got a typo in there, or if you're noting down the age of someone, and the next year you're noting down the age of someone again, then one time he's 42, for example, and the next year is 43, then there are different entries in a database. And then depending on how the system works, it handles these two entries as two different persons. So this case, the solution would be to ask for a birth date. This would be the one solution, but you have to think about many of these smaller and bigger kind of things, to handle data.
Right. Great. So do we have any more questions? Any interactions, any discussions? No, are we all good? Yeah. Right.
Thanks for the possibility and your questions and the moderation, and hopefully we can do that again.
Yes. So
in healthcare with data or another topic.
No, thank you so much, Phil. Thank you for your time, and I'm thanking
You're welcome.
everyone else for participating. And so this is a platform for everyone. So let's all come forward and share knowledge and share information so that we all gain more. I mean, we're more intelligent people then if we get so much knowledge from everyone. Yeah. So thank you all once again, and
Thanks,
let's meet.
Phil.
Yeah, let's meet during the next webinar.
Thank you. Thank you, Phil.
Thank
Thank you,
you.
Phil.
You're
Thank you
welcome.
very much. Thank you.
Thank you,
Bye-bye.
Have a
Phil.
nice
Everybody.
evening, most of you.
Bye.
Bye.
Take care. Bye-bye.